Hello and welcome. Let's talk about deep vein thrombosis. Deep vein thrombosis is a blood clot that in a deep vein. Usually it happens in the leg. If it happens in the superficial vein under the skin, then it's called superficial thrombophlebitis. But this as well can travel to larger deep veins, then it's classic DVT. DVT in reality can be life-threatening. Deep vein thrombosis have certain symptoms that can happen as leg swelling, leg pain, cramping, or soreness that often starts in the calf. Change in skin color on the leg, such as red, purple, depending on the color of your skin. A feeling of warmth on the affected leg. Deep vein thrombosis can also occur without noticeable symptoms. Now, the causes can be elaborated as anything that prevents the blood from flowing properly. Clotting can cause a blood clot. The main cause of deep vein thrombosis are damage to a vein from surgery or inflammation or damage due to infection or injury. Now, there are many risk factors. There are many things that can increase the risk of developing deep vein thrombosis. The more risk factors you have, the greater your risk of deep vein thrombosis can happen. Risk factors for DVT include, with regards to age, being older than 60 years of old increases the risk of DVT, but DVT can occur at any age. Then there is the lack of movement when the legs don't move for a long time. The calf muscles don't squeeze or contract. Muscle contraction helps both blood flow backwards towards the heart. Sitting for a long time, such as when driving or flying, or increases the risk of DVT. So does long-term bed rest, which may result from lengthy hospital stay or medical conditions such as paralysis. Injury or surgery are also a cause where injury to the veins or surgery can increase the risk of blood clots. Pregnancy increases the pressure in the veins in the pelvis and legs. The risk of blood clots from pregnancy can continue up to 6 weeks after the baby is born. People with an inherited clotting disorder are especially at risk. Birth control pills, oral contraceptives, or hormone replacement therapy both can increase the blood's ability to clot. Being overweight or obese is also a factor. Being overweight increases the pressure in the veins in the pelvis and the legs. Smoking is also one big factor, and smoking affects how blood flows and clots, which can increase the risk of DVT. Cancer is also a cause, where some cancers increase substances in the blood that cause blood to clot. Some type of cancer treatments also increase the risk of blood clotting. Heart failure is also one big factor, where heart failure increases the risk of DVT and pulmonary embolism, because the heart and the lungs don't work well in people with heart failure. The symptoms caused by even a small pulmonary embolism are more noticeable. Inflammatory bowel disease, Crohn's disease, or ulcerative colitis increases the risk of DVT. A personal or family history of DVT or pulmonary embolism, if you have or someone in your family has had one or both of these conditions, you might be at greater risk of developing DVT. Genetics is also one factor, where some people have DNA changes that cause blood to clot more easily. One example is factor 5 Leiden. This inherited disorder changes one of the clotting factors in the blood. An inherited disorder on its own might not cause the blood to clot unless combined with the other risk factors. Sometimes a blood clot in a vein can occur with no identifiable risk factor. This is called an unprovoked VTE. Complications of deep vein thrombosis can be pulmonary embolism, where pulmonary embolism is a potentially life-threatening complication associated with DVT. It occurs when a blood clots or thrombus is formed in the leg or other body areas, breaks free and gets stuck in the blood vessels supplying the lungs. They include sudden shortness of breath, chest pain while breathing in or coughing, rapid breathing, rapid pulse, feeling of faint or fainting, and coughing up blood. Post-phlebitic syndrome is damage to the veins of the blood clot reduces the blood flow in the affected area. Symptoms include leg pains, leg swelling, skin color changes, and skin sores. Treatment complications are very varied, where blood thinners are often used to treat DVT. Bleeding or hemorrhage is the worst worrisome side effect of blood thinners. It's important to have regular blood tests while taking blood thinning drugs. Life-threatening changes may help prevent deep vein thrombosis. Try these strategies if you like. Move your legs. If you had surgery or have been on bed rest, try to move as soon as possible. Don't cross your legs while sitting. Doing so can block blood flow. When traveling, try frequent breaks or stretch your legs. When on plane, stand or walk occasionally. If you're traveling by car, stop every hour or so and walk around. If you can't walk, do lower leg exercises. Raise your lower heel while keeping your toes on the floor, then raise your toes while keeping your heels on the floor. Don't smoke because smoking increases the risk of DVT. And also manage weight because obesity is a risk factor for DVT. Regular exercise lowers the risk of blood clots. As general goal, aim for at least 30 minutes for moderate physical exercise or activity every day. If you want to lose weight, maintain weight loss, or meet specific fitness goals, you may need to exercise more. Tests to diagnose DVT are many, like duplex venous ultrasound. This is the most common test for diagnosing DVT because it is non-invasive and widely available. This test uses ultrasound waves to show the blood flow or blood clots in your veins. A vascular ultrasound technologist applies pressure while scanning your arm or leg. If the pressure doesn't make your vein compress, it means there is a blood clot. If the results of duplex ultrasound aren't clear, your provider can use another imaging test. The other thing is venography. In this invasive test, you provide the numbs of the skin of your neck or groin and uses a catheter to inject a special dye, which are contrast material, in your veins to see if any blood clots are partially or completely blocking the blood flow inside your veins. Venography is rarely used nowadays, but sometimes it is necessary. Magnetic resonance imaging or magnetic resonance venography or MRI shows pictures for organs and structures inside your body, whereas MRV shows pictures of veins in specific locations in your body. In many cases, MR and MRV can offer more information than duplex ultrasound or CT scan. Computed tomography scan is a type of X-ray that shows structures inside your body. Your provider may use a CT scan to find a DVT in your abdomen, pelvis, or brain, as well as blood clots in your lung, which may be pulmonary embolism. Or clinically, there is a Hoffman signs, which is calf pain on dorsiflexion of the foot. It is positive for less than 33% of DVT patients and more than 50% of the patient who don't have DVT. If your doctor thinks you may have a genetic acquired clotting disorder, you may need to have a special blood test. This may be important if you have a history of blood clots that your provider can't link to any other cause. You have a blood clot in an unusual location, such as vein from your intestines, liver, kidney, or brain. you have a strong family history of blood clots, you have a family history of specific genetic clotting disorder, a DVT may make it harder for you to get around at first because leg pain and swelling, but you'll be able to slowly return to your normal activities. If your legs feel swollen or heavy, lie in the bed with your heels propped up about 5 to 6 inches. This helps improve circulation and decreases swelling. In addition, exercise your calf muscles if you are sitting still for a long period of time. Stand up and walk for a few minutes every hour while awake, and especially during long haul flights or road trips. Wear knee high compression stocking. These minimize leg pain and swelling by at least 50% if you wear them daily. Avoid activities that may cause a serious injury. Stay hydrated all the time and especially during travel. DVT treatments are many, but basically anticoagulants are used or blood thinners. This type of medication makes it harder for your blood to clot. Anticoagulants also stop clot from getting bigger and prevent clots from moving. Anticoagulants don't destroy or melt blood clots. Your body may naturally dissolve a clot, but sometimes clots don't completely disappear. When they don't, they usually shrink and become little scars inside your veins. Sometimes old clots may result in leg swelling, but oftentimes they don't cause symptoms. There are different types of anticoagulants: warfarin, heparin, oral factor Xa inhibitors. Your doctor will talk to you about the best type of medication for you. If you need to take an anticoagulant, you may have to take for only a few months. Usually there is 3 to 6 months, or you might take it indefinitely. Your treatment time may be different depending on the specific situation of each individual, including if you have clots before. You're getting treatment for another illness like cancer or autoimmune disease, you as your risk of clot is higher. Bleeding is the most common side effect of anticoagulants. You should call your doctor right away if you notice any bruise or bleed easily while taking this medication. Now, the compression stockings are also very important. You'll probably need to wear graded elastic compression stockings to either improve or completely get rid of leg swelling. Damage to the small valves inside your veins often cause this swelling. You may also have swelling because DVT is blocking the blood flow in your vein. You wear most of the compression stocking just below your knee. These stockings are tight at the ankle and become loose as you go away from your ankle. This causes gentle pressure compression on your leg. Several clinical studies have shown that compression stocking improve the symptoms of leg pain and swelling by at least 50%, as long as they are worn daily from morning to evening. They don't have to be worn overnight. After surgery, your provider may put compression devices on your calves to put pressure on them. These machines squeeze and release fabric covered devices around your calves while you're lying in the bed. These devices help prevent DVT if you are in hospital, but they aren't prescribed outside the hospital. In addition, unlike compression stocking that you can wear safely when leg DVT is present, you shouldn't use these devices for DVT prevention if you have a DVT. Now we move towards definitive treatment. There are recommended treatments for anticoagulants for the acute management of DVT. Firstly, it's heparin, where we give 80 internal units per kg IV with maximum of 10,000 units. This is for the bolus dose, with continuation with infusion 18 internal units per kg per hour. The aim is to achieve an activated partial thromboplastin time of 1.5 to 2 multiplied by that of the baseline. The second is the delta-pan sodium, 200 units per kg per day given subcutaneously or maximum of 18,000 units per dose given for more than 5 days and overlapping it with warfarin until INR or international normalization ratio is around 2 to 3. The third is the enoxaparin sodium given subcutaneously with 1 milligram per kg for 12 hours alternatively. 1.5 milligram per kg given continuously for greater than 5 days and overlap it with warfarin until international normalization ratio is around 2 to 3. The fourth is the rivaroxaban given 20 milligram orally while started with 15 milligrams orally for 21 days or give 15 to 20 milligram per tablet with food. Consider discontinuation for greater than 24 hours in case of any required surgery or procedure. The fifth is dabigatran for patients with creatinine clearance of greater than 13 ml per minute or given 150 milligram orally twice daily for 5 to 10 days after parenteral or intravenous dosage anticoagulation. The sixth is fondaparinux for the body weight less than 50 kgs, give 5 milligrams subcutaneously, or for 50 to 100 kgs, give 7.5 milligrams subcutaneously, or for body weight greater than 100 kg, give 10 milligrams subcutaneously daily for all doses. Now, these are all the definitive treatments that are needed in DVT. Care of Take care of self and do subscribe and like a channel. Thank you.